Assalamu alaikum. We'll start again. We'll have a short talk about INR. I hope it will give you some new information. Who knows what's INR? صوت? International normalized ratio. Okay. I mean, who cares? صوت؟ Yeah, based on what? I mean, if you bleed, we calculate time, صح؟ That represents your cardiability. But I cannot create number، صح؟ ما أقدر أقول للبلد اسمع في عندنا رقم اسمه INR أبغاك تلتزم معاه، لما يصير هاي تصير أنت هاي، ما ينفع زي كذا، صح؟ So what is it? BT and BTT. Who's saying BT and BTT? إيش لما كل ما طالع في أحد يخاف؟ وش السالفة؟ So BT and BTT. Who think INR is BT and BTT? BT and BTT. واحد بس. وش هذا؟ اثنين، ثلاثة، أربعة. 4 من 50 من 200. طيب اللي ما رفع يده مش اعتقدوا؟ ما ندري، والله جابوه لقيناه في اللابز حطيناه به. يعني you mean BT and BTT together. بس أنا أقصد we are using BT and BTT. BT only. So it's actually BT only. خلاص. So the number of INR is actually correlated مع BT. BTT has nothing to do with it. خلاص. So I think of like most of our internal students and me when I was an internal student, I would think that BT and BTT both get the INR. But then I discovered yesterday that it's only BT. خلاص. No, I know from before, but just so it's actually synchronized or correlate well with the BT, and they get that number because of what? The name. So they want it standardized. They want the number standardized instead of me saying BT is 79 or BT. Sorry, BT will not come 79. As an example, BT is 50. I don't know what I'm talking about. What's 50? 50 second, 50 millisecond. What I'm talking about? So instead of saying that, I will say INR is 1. So INR is 1 equal normal BT. Okay? So بدل ما نقعد نغير ونتفق على الوحدة ونختلف على الوحدة. If I said INR is 1, that means BT is normal. خلاص؟ بس this is number we didn't create in the blood. خلاص يعني الجسم ما يعرف وش INR هذا. الجسم يعرف BT and BTT only. Okay? That's clear? So when we are talking about high INR or INR management, what do we know about it? So do we scare when we see INR of like 9? Yes. طيب واحد شخص واحد فقط يلا تفضل. مين اللي يقول ايش السؤال؟ تفضل دكتورة. So the number of INR, is it scary for you? When you see 9 is different than like 5? So what does it mean for you? Alhamdulillah. So if it's 9 he may bleed, but 5 is not. طب 3? Okay. So what I understand from you that if the INR is 3 is, yeah, not all patients. So I'll tell what you are saying. So if you told me that if INR is 3 and the patient is atrial fibrillation, 2.5 the target, right? Atrial fibrillation and he's on target, his risk of bleeding is low. Risk of clotting is what? Is low or high? High? So the difference between 5 and 9. So my question is the difference between 5 and 9. If you have INR of 5 and INR of 9, same patient, he came 2 or 3 months back with the INR of 5, now he came again, INR is 9. Does it make any difference? انتم مالكم صوت هذا؟ ها؟ ماشي عندهم خليهم ها؟ Okay. So everybody agree on this؟ هذا المتحدث الرسمي؟ No. ها أعطين. ما هو مكتوب؟ ما هي واضحة، أنا بالقصد حطيتها ما هي واضحة عشان ما حد يعرف يقراها. So they found by study, and that's why the recommendation came from those studies, that a patient between 5 and 9 INR, the risk of major bleed is only 1%. So that's why when you came with INR of 5 and you don't have a clear source of bleeding and you are not bleeding well, nobody really care. I don't say that we don't care, but nobody really is scared because the risk of major bleeding is very low. 1%, I mean, it's considered protective. If you are walking in our hospital here, you can fall and have bleeding higher than 1% risk. So if you have an INR between 5 and 9, your risk of major bleeding without anything, spontaneous major bleed, is only 1%. So that's the good news. So if you have INR or high INR, what's your choice of treatment? Let's not talk about the detail. We'll talk about detail later. But what's your choice? What medication you know will reverse INR? Yes, please. Tell me the choices only. Fresh frozen plasma, 1. Vitamin K, 2. So, is that if he had an anticoagulant and what? So you hold the dose. Okay, good. So you can hold the dose, hold his medication. What else? Factor. زي 5 ولا 7؟ The BCC complex صح؟ ممتاز. البي سي سي. في انا سمعت هنا واحده كمان بس ما. فاكتور 7 good. فاكتور 7 excellent. What else؟ هذا هي مكتوبه لو ما هي مكتوبه شكيت انا. خلاص قلت لك لا طيب. So this is the treatment. Just keep it in your mind. We'll talk about the indication later. The problem of INR management that most of the time you can treat it by holding the treatment only. Most of the time, around 90% of the time, if you hold your medication, that will be enough for the patient. So don't exaggerate things and try to do like a hero thing and give vitamin K, give IV fresh frozen. Let's throw everything in. Yes, please. Wait. We are going to the guideline now, but just this is as a general rule. Don't jump directly. So as a general rule, you can hold the treatment anytime, and it will be enough for the patient. And we'll see when we reach the guideline. Most of the time, holding the treatment is enough. خلاص? So let's move on. I think they are stupid. You know why? Because both of them are American, and both of them are in the chest. And they're still creating two different guidelines. Everybody is creating his own guideline, and they are fighting on it, and nobody is convinced to take the other people guideline. So the American Society, American College of Chest Physician and the American Heart Association every one of those has his own guideline, and it's a little bit different between like 4.5 and 5 and like this. It's very small different number, but everybody had his own guideline. I think I decided to create our own guideline also for this because I don't know why they're changing the number. 4.5 and 5, what's the difference? So when you have a high INR patient or patient who's on anticoagulants, what's the two questions you need to know? Is the patient bleeding? And? What is the INR? Good. For the sake of guideline, you need to ask yourself two questions. Number, what is the INR number exactly? And does he have bleeding or not? And if we're talking about bleeding, it's two things, major or minor. Okay? Some people add the life-threatening. I think the same for major bleeding, so we don't add life-threatening. Life-threatening with the major bleed. So life-threatening or major bleed versus minor bleed. The other question is the number of INR exactly. So let's start. Let's start by the guideline. So I took some guideline from AHA and some of it from the ACCB, the American College of Chest Physician. I combined it together to get you an easier one. You can follow whatever you wanted. You can check the guideline. It's on the website. It's free. You can see it anytime. But I think it's easier for you to follow this one because this one almost didn't change since 2008. They changed it recently in 2013, but it wasn't a big change, and it was even worse than the old one. So if you want to follow anything, follow the old one. I think it's better. Anyway, there is no big difference between them. So let's start. So if your patient had a major bleed, intracranial hemorrhage, GI hemorrhage, joint, hemorrhage, what you will do? Salt, hold medication, fresh frozen plasma, vitamin K, IV oral, IV. ايش فيك تقولي لي كأنها هذا فاكت؟ انت اللي بتقولي. You consult. طيب. That's all. Factor 7. يلا مين يزود؟ أهم واحد ما قلنا BCC. Excellent. BCC good. So actually اللي عليهم good evidence now هم ال two things اللي هم الفيتامين K والBCC. في مشكلة بسيطة في الفيتامين K إنه الريفرسال حقه يقعد some time. يعني البيشنت لو حيرجع على وارفرين you need to keep him on heparin for some time. If he had important disease to keep him anticoagulated I mean. So a problem with vitamin K that the reversal will stay for some time, stay for a week, a month. So if you reverse it by vitamin K, you give IV vitamin K 10 milligram, he will stay for 3 weeks resistant to warfarin. You cannot put him back on warfarin again. So you will throw everything, but the only thing that had an evidence and it's in the guideline is the BCC and vitamin K. Fresh frozen and factor 7 and what else we said? So fresh frozen and factor 7, they had no evidence, still in the guideline. You can consider it, but no evidence on this. The main thing to do is BCC and vitamin K, okay? And hold the treatment. Hold the treatment is the most important. And you should pray, okay? Pray very well. Because you killed him, you know? So if he had a minor bleed, a cut wound, small cut wound, what you will do? Compression, good. I like it. طيب compression غيره. So you will hold the dose. So you reduce it. So in case of bleeding, any bleeding, you need to hold the dose. So if in case of bleeding, you need to hold the dose, not only reduce it. We'll talk when you need to reduce it, but you need to hold the dose. Hold the dose, and vitamin K is on consensus. Actually, the guideline, they took it off. No more vitamin K in those patients, but it's on consensus. They say expert opinion, they think it's good to give vitamin K and it's not harmful anymore. You can give it if you want, and if you are lazy to follow up the patient, you can give him vitamin K. It for sure will reduce the INR for at least 1 or 2. So if you are lazy to follow the patient or your follow-up system is bad, you can give 1 dose vitamin K and send the patient home. Most likely they will go home, those patients. But if you have a good follow-up system, holding medication will be enough. Holding medication without giving vitamin K will be enough for this patient, okay? So let's talk about number. So asymptomatic patient and INR is less than 4.5. This is from the American guideline, I think. From the American Heart, both of them are American. So American Heart Association, if less than 4.5, no symptom, what you will do? So just adjusting the dose. Excellent. You don't need to do anything else. Just adjusting the dose. You can hold 1 dose, but mainly reducing the dose is enough. So between 4.5 and 10, vitamin K. Who's voting for vitamin K? So hold the dose will be enough again, but you can give vitamin K for patient on high risk of bleeding, like elderly patient, the patient who is at risk of fall. You can give the vitamin K orally, not IV. So no IV dose for those. You need to give them vitamin K orally if he's at risk of if it's at high risk of bleeding. Last group. Again, holding the treatment is enough, but based on the old recommendation for ACCB, the American College of Chest Physicians, and the current recommendation for AHA, you can give oral vitamin K, but holding medication will be enough. خلاص? Based on the new guideline, holding medication will be enough for ACCB, but AHA still keep giving vitamin K for those patients. So you can have both, either give, still 2 minutes. Right. That's all.